And when we talk about alternatives, medical treatment is certainly an alternative. For certain individuals, long-term success happens. But being realistic, longer than 5 years, it is only about 1 in 400 people, to the best of our understanding in literature. In the short term, however, boot camp works for almost everybody. The Biggest Loser and all these TV shows really show that if you go to boot camp, you will do well in the short term. Most of my patients who I've operated on have lost 30, 60, even 90 pounds, some of them 2 or 3 times. The problem was not that they couldn't lose weight. The problem was the durability. And so I am very happy to help people with medical weight management. We will have a medical weight management component growing in our program. In my program in Duluth, which was comprehensive, we had a very strong medical program. But I think for many people, it's not the long-term answer. That being said, however, I think there's some real important things to think about for somebody who wants to do medical weight management. And that is, I'm on the wrong slide here, but let me go forward one. The weight loss for most people is modest, but it can be helpful. I'm going to skip over that. Here we go, down at the bottom of this slide. I think a lot of people want to empower themselves that they've given it the last chance, that they're ready for surgery, they're doing the diet and the exercise combination. Definitely the combination works better than either diet or exercise alone. Certainly medications can be helpful in terms of taking, on average, about a 10-pound weight loss to a 15 to 20-pound weight loss over 1 year. But there's no study that shows long-term benefit from these meds. And in fact, some of them, most of them are off the market now because they actually show shorter-term problems with heart attacks, suicide, things like that. And when you go putting a pill in somebody's body and trying to change switches in the brain, you mess with a lot of different things. And the medications that affect stimulation also impact the heart and the blood pressure. So be careful with the meds. We can help you use them and use them as safely as possible. But for the most part, it's diet and exercise based. And there's a lot of good that can come of that. The opportunity to stop shaming and blaming and say, wow, I really can make changes in my life, but my appetite is not something I can just turn a dial for. I can change what I shop for. I can make myself get outside and exercise every day. But that does not necessarily, for most people, even if they're living perfect, give durable weight loss. I do believe in empowering patients, though, and I think it's better to advance than retreat. That's always my joke in medical things like, well, let's have a retreat. Let's have an advance. Let's go forward. And I think this is an advance for people, and if it's what you need, then I am happy to help you with it. I just don't want to overpromise that it is durable for most people, but I think it can be very helpful. Developing insight, skills, contacts, these are all good things. Now, what is the risk of non-treatment of obesity? This is the opposite of that previous slide about showing years of life regained. These are years of life lost. And if you look into the eyes of your mom or your spouse or your friend and say, do you realize what my weight is taking off my life potentially? Don't you think it is worth me taking some chance of surgery to get this back? If I had gallstones and gallbladder pain, you wouldn't tell me not to have my gallbladder out and just suffer. You would say, why don't you go get your gallbladder out? Some people treat that like it's drive-through surgery. It's a real deal too. There's no such thing as minor surgery when it's on you or somebody you love. But look at the cost of obesity. Look at the years of life lost. This is only a BMI of 45. This is not a high weight in our society. And for a young person, age 20, and this is males tend to have more heart attacks and die younger. A 20-year-old male with a BMI of 45 is losing 12 years of life. This is average. If you wait until these people are 40, 50 years old, a lot of these guys are already dead. So when a primary care doc says, oh, let's wait until you have that first heart attack, half your guys are going to be dead of their first heart attack. They don't get a chance to then go in and have weight loss surgery. Early intervention for a population is probably really key to get the best results. Now, that being said, even if you are 70 years old and a male with a body mass index of 45, you're going to get a couple of years on average as a population of added life expectancy. And for women, also, the numbers are not quite as big in terms of the number of years, but very significant. I want to mention here also, though, while number of years of life is very important, and we all want to be around as long as we can be. Life in your years, your vitality, your ability to go and enjoy life, even if I personally, and I hope not, even if I die tomorrow, the 2.5 years of benefit that I've had with weight loss surgery have been unbelievable in terms of getting my life back. And what I hear more from people about than, oh, I'm glad I might live longer, oh, I'm glad even that my diabetes is under control, what I hear the most from people is, I feel 20 years younger. I feel like I can go and do like I haven't. I was living like an old man, and now I can go snowboarding again. I can get in a sports car. I can have some fun. So this is very important. But we're not just here to live the max number of days on the planet. But it's still very compelling, and it certainly makes worth thinking about for your family. You do want to be around for them. We're just starting to really get more information in the last 3 to 5 years about cancer risk, particularly. We talked a lot about diabetes and heart disease in terms of early mortality, but cancer risk is probably almost as important overall in terms of taking people's lives prematurely. And with obesity, the risks go up more than we realized. So please be aware of this. You'll see more as we get more in the literature, particularly also compelling for young people. This risk of liver cancer, you can't read this, goes up by over a factor of 4. And this is people who tend to have inflammatory change of their liver from a very young age. Fatty liver disease is the second leading cause of cirrhosis now. I'm not going to read all these off in interest of time, but just know that the cancer risk increase is very real with obesity.